Hello everyone, my name is Diogo and I'm here representing the CaregIVR Project. Thank you for being with me in this literacy session. The CaregIVR Project is an Horizon project and it's co-funded by European and multinational funds. It brings together four countries, Portugal, Spain, Italy, Poland, with the collaboration of Ukraine. The project is coordinated by a SATLA, Escola Superior de Saúde Atlântica, and our main goal is to improve the health literacy of caregivers, especially about cardiovascular diseases. We also aim to help them to develop better caregiving skills using different tools, including immersive virtual reality and apps. Let's start talking about what is a stroke. The World Health Organization defines a stroke as a sudden neurological problem with a vascular origin that affects part or sometimes all of the nervous system, and the signs and symptoms last for more than 24 hours. But this global definition doesn't say everything. To understand what is a stroke, we need to understand what our nervous system does. And our brain controls pretty much everything in our body, all our functions. It controls our vital functions like breathing and heart rate. It controls our mobility like walking, standing, or using our hands. It controls communication like speaking clearly or understanding others. It controls reasoning like making decisions or solving problems. It controls emotions like feeling happy, sad, or frustrated. And also defines our personality, like how we behave, how we relate with each other. So when a stroke happens, it can affect how we move, how we speak, how we think, and even how we feel. So to keep all these functions in our brain needs a lot of energy to work properly. Uh, Even though it represents only about 2% of our total body weight, it needs around 15 to 20% of all our blood supply. This blood flow is essential to bring oxygen and nutrients that the brain needs to keep these cells functional. When one of the arteries has a problem, the brain functions can be affected. Sometimes a rupture can occur, which we call an hemorrhagic stroke. Other times, a vessel can become blocked, known as an ischemic stroke. In both cases, blood cannot reach the brain cells, which means that they are unable to get the oxygen and the nutrients they need, causing them die very quickly. This is why strokes are medical emergencies and need immediate assistance. With a stroke, you need to be fast. And be fast is a mnemonic that you can use to remember what are the signs that can help us to identify if someone is having a stroke. So, I'll recognize if someone is having a stroke. An easy way to remember is the main warning signs is that this acronym Be Fast brings. B stands for balance. The person may suddenly lose the balance, or sometimes they feel dizzy with the lack of coordination. E is for eyes. They may have a sudden trouble of seeing in one of both eyes, sometimes double vision, it calls diplopia. F, if for it's for face, it is common to ask these people to smile, and one of the sides of the face may drop. A stands for arm. It's important also to ask them to raise the arms, and one of the arm may drift downwards or sometimes doesn't raise so much. S is for speech. Their speech may be slurred or strange or sometimes doesn't make sense what they say. And T, it's for time. If you notice that any of these signs, it's time to call the emergency service immediately. Action quickly can save a life and reduce the impact of a stroke. What causes a stroke? There are many risk factors that contribute to a stroke, but it is not always possible to define a clear cause. There are non-modifiable risk factors and modifiable risk factors. The non-modifiable risk factors are something that you cannot change: our genetic, our age, and our biological sex. But the modifiable, it's something that we can do something about. It is our alcoholic habits, diabetes, tobacco, sedentarism, hypertension, obesity, stress, sleep apnea, and among others. So let's look at some of the most common signs and symptoms of a stroke. One of the most typical signs is a loss of strength. Normally, this loss of strength is in one of the sides of the body. It could be sometimes more in the arm, sometimes more in the leg, or even in the face. Many people also have difficulties to speaking or understanding what others says. This can be very frustrating, both for the person and for the those around them. Like you, like you that you like the people that care these people. They may also be some changes in thinking, like trouble in memory, attention, or the ability to solving problems. And finally, not so visible, and we don't talk so much about this. Strokes can affect a person's personality and emotions also. Some people may become more anxious, sad, or even more have like mood swings. It's important to remember that every stroke is different. Not everyone will have all these symptoms, but this is the common pattern. Now that we talk about the direct effects of a stroke, it is also important to understand that there are some indirect consequences, secondary consequences. These don't come from the brain damage itself, but from the fact that the person may be spending more time in bed, moving less, or having difficulty in communicating their needs. For example, they may develop musculoskeletal problems like muscle contractures or shoulder pain that is very common. They might also have skin injuries, such wounds or infections, especially if they stay in one position for too long. Circulatory problems can appear too, like poor blood flow in the legs or even Blood clots. There can also be digestive and urinary problems like constipation or incontinence, and finally respiratory problems like aspiration pneumonia can happen if someone swallow if these people have swallowing problems, especially. These complications can make recovery harder, and it's important to prevent them as much as possible. Finally, let's take some time to talk about this. Probably this theme is not totally new for you because because you are taking care of a person that had a stroke, but there are always some doubts, and this is a safe place to share problems and to share knowledge also. Let's talk about this.